Hello. Let's get Chris in here. We'll get started in a moment. Hey,
Hey,
Christian.
hey,
How are you?
I'm pretty good today.
Good. Today? I hope you're good every day.
I am good every day. This is my first time going live actually on Instagram at all, so I'm a little nervous.
I know, just don't drop the phone.
Okay, right. Hold the phone. I have
I'll
it
try not to drop my phone too. It's like sliding around. I'm trying to keep it steady.
right.
Um, so we'll give people a little bit of time to join. I know this is your first time on Instagram Live, and it's actually your first time on Instagram Live with Whitman-Walker.
Right.
Um, so once we get people in, we can introduce ourselves. I actually like to know in that introduction a little more about you, where you're from, and what made you get into this work, that
Okay.
type of stuff.
Sounds good. My guy have me exposing myself on Instagram. No, kidding.
That's, I mean, you can share as much or as
That's it.
little as you want.
I understand. I understand. I'm also trying to do this outside for like better lighting, So, but if the neighborhood like sounds or anything get too loud, let me know.
Okay, I think you'll be fine.
Okay.
Yeah.
Cool. Yes. On my side, it only says one person is on, but I see multiple names in the list. So how does that work?
So it depends. So people tend to come in and out. Like it just jumped up just now. So it can also be a delay and that little mechanism at the top that tells you how many people are in
Okay.
it. So it'll fluctuate up and down. Yeah. So it doesn't actually keep a full tally of everybody who joins. So it only keeps like the active viewer number there.
Okay. I got you. How
Yeah.
often do you do this? You do this every week?
Yeah, so I've been doing it every week. So I guess we'll get started. So let's jump in. So I do want to call to the comment I pinned. So Whitman-Walker is doing HIV and STI testing right now. It is by appointment only. So if you are interested in that, please call 202-797-4439 and to make an appointment. So I am David Wilson. If this is your first time joining me on our Whitman-Walker Instagram Live, I'm a social media influencer. I always get cringy when I say influencer because I'm like, so weird. But that's the title, social media influencer for our community health team. Um, I've been here since January, so I've been doing this every other week. It kind of picked up. At first, we were doing it like a once or twice a month, but now it's every week. So yes, I've been doing this every Tuesday. Different topics. But right now, since COVID's happening, a lot of our topics and our shift in topics have went towards
Right.
those type of things. And so, but we cover a lot of things, and we have the flexibility to talk about a lot. So if you're ever interested in coming back after this conversation, please let me know.
Okay, I will be. I love to talk, like, period. I would love to do some type of, I don't know, bi-monthly or something. We could do talks with Chris or something.
Yeah,
Yeah.
we can do talk with Christian every other month. I'm for it.
Okay.
So if you want, go ahead and introduce yourself.
Okay, absolutely. All right, so my name is Christian Morris. Um, so I'm from New Orleans, Louisiana. I've been working at Whitman Walker for only 2 months now. I started this this August. I'm a community engagement specialist at Whitman Walker, which is the first time they've actually had somebody officially in that role, which is pretty cool. And basically, my direct supervisor was just, trying to get funding for the position. He's like, I think we would benefit from having somebody who sort of does this work in the research department specifically. So not for the organization as a whole, but in the research department, somebody who good at talking to people and will keep folks engaged and things like that. Yeah.
Yeah. And so I am a part of that community advisory board, and I will admit that your presence is definitely known. And so I'm excited to see where you take everything with the CAP. So speaking of the CAP, So today's session, we are going to be having a discussion about Whitman-Walker's Community Advisory Board. I also want to point out that during these times, we know it can be stressful, but it is also extremely important to be informed about COVID-19 and to get that information from a trusted source, i.e. Whitman-Walker.
Right.
I encourage everyone who's tuning in to ask questions in the comments, and if we can answer those in real time, we would definitely do that.
Right.
So I mentioned, the Community Advisory Board, or also known as the CAB. What is that exactly?
Absolutely. Okay, so a community advisory board, we actually have a few with Whitman, but the one that I'm working on, this is really exciting, actually. It's really interesting. So basically, Whitman-Walker is participating or will be participating in a grant-funded research project for a vaccine for HIV. So we're not recruiting people for the drug yet, but we're just in sort of the community input phase of this research study. But this research study is about a potential vaccine to HIV. So that's really exciting. If everything goes according to plan, the medicine works. I mean, imagine how different our realities and our lives will be if we can get vaccinated for HIV as young Black gay men, especially. You know what I'm saying? So it's
Yeah.
really so basically, the community advisory board right now is just to sort of get input from folks from the community as we go about doing the research study. So general HIV prevention education, things. Yeah, it's just supposed to be like basically a feedback loop from community members into the research that we're doing.
Yeah.
Mm-hmm.
And so I have heard a little bit about the obviously the study itself. And so I'm extremely grateful to be a part of that discussion, to give input on how we basically should operate this particular study.
Right,
And it's also exciting to see so many different perspectives that are going into this type of advisory board.
right.
So we have trans people on the board. You have myself, a gay man. We have people who are actually living with HIV on the board, and so that it gets so many perspectives, and I
Right,
think it's an amazing solution to
right,
make sure that different views are considered when we're doing these
right.
type of studies.
Absolutely.
So what are some of the main priorities of the CAP that you're on right
Right,
now, outside of the
absolutely.
HIV study?
So, kind of as you're talking about, like the different community members, like basically the importance of having them participate is that, a vaccine is no good if one, our people don't know about it, or two, we're too afraid to take it. So, the Community Advisory Board is an opportunity to actually talk to people who live in the community who are navigating these things. Hey, how would you like us to talk about this? What would interest you to participate in this? You know what I'm saying? Because we have to, another thing is that's important is we have to try these vaccines and these different clinical drugs in the populations we want them to be successful in. So if we have no, low income Black folks in the research study in the process, we're not going to know if it's actually going to work when it hits the market. So it's just about actually having the people involved in the process we want it to benefit.
Yeah. No, I think that that's a great point, kind of highlighting what I mentioned earlier. And I think it's also because we're always looking at things from our lens and our perspective, right? And so
Right,
I've also noticed, being an active member on this board, is that since we have so many different type of people from so many different backgrounds, that they're often able to insert a particular viewpoint that we wouldn't have thought of.
right,
And sometimes that even influences the way that you actually conduct that study,
right.
and maybe even consider modifying that to fit
Absolutely,
certain populations. Yeah.
absolutely, absolutely.
Um, and so, like, I have a engineering background, so like I know how important research is, but that's from a very different perspective, right? So, like, when I'm doing research, it's definitely not on human bodies, or
Right,
like, it's on systems and things that are tangible but not biological, if that makes
right,
sense. And so I have my own barriers when it comes to
right,
doing research. And so I'm interested in, like, why research important when it comes to the medical and public health field, but also like what type of barriers that you
Right.
have to overcome in that area.
Yeah, for sure. It's a huge difference doing research on a machine, right, with metal and plastic versus asking somebody to
Yeah.
come and either tell really intimate details about their life or give blood or, as far as take a medicine. So I think it's just the challenge of actually motivating people to invest themselves. And I think it's a really good question. Why care? Why is it important? And somebody said in the comments earlier, research saves lives. And it's true. It saves lives and it saves quality of life as well. Any medical we have in our day and age only came through research. And I think that there's such like a traumatic history for especially with research, so I understand the hesitance. So I think that's more so where the barrier comes in is the distrust of the medical community, the distrust of people who went to fancy schools, fancy degrees, who have never been through the things that our community has been. But it's strange because we also stand so much to benefit from this research,
Yeah.
us specifically. So it's really so this is the role of my job, actually, is figuring out how to have this conversation with people. It's like I know that we have these physical feelings and hesitations, but how can we motivate each other to like actually care about this? And so yeah, again, at the end of the day, like research saves lives, period. Hold on, let me check my notes, make sure I'm not missing some other points.
No, I think it's good. I think you're hitting it right on target. So definitely research save lives. But you also brought up something I haven't even thought about myself. So as a Black man who certainly will benefit from the HIV vaccine, I am intimidated. Even though I'm on the
Right,
advisory board, I'm a little bit intimidated about participating in certain research studies. And I think one thing you hit on is that from a historical context, when it comes to Black people, at times we were often, like lab rats in a sense
right,
for like certain studies before there were actually like human rights for people who look like us.
right,
And so I think we still carry a lot of that, trauma
right,
and like getting over that. And so
right.
that you have a job for yourself to figure out
I
how to get
do.
people, engaged in these type of things. But I never really thought about that. So thanks for heighten
Mhm.
bringing that to my attention.
And I'll say a couple other benefits from it. I was actually just talking to somebody who's been living with HIV since the 90s, and he was just saying that he got involved in research because at the time it was the only way that he could access medications. Um,
Oh,
and so I think that was a really interesting like, perspective. What?
yeah. No, I laugh at because that I got into a research study as one research study I participated. So prep, when prep
Yeah,
first came around, I participated in the study.
yeah,
Um, my medical provider basically gave me some, advice, and thank God, and she's an amazing provider at Whitman-Walker. Um, and I trusted her advice, and she was like, "I think this is for you. I think this is
right,
something that you definitely benefit from."
right.
Um, it was further along in the trials, so it was like, she gave me all the information, the facts, and I made the decision to participate in the study, and I've been on prep ever since. But you're absolutely right. At that
Right.
time, it was extremely hard to get prep. It
Mm,
was also extremely at that time there wasn't really a mechanism around like the financial aspect of it. Like medical providers were not
right.
even like funding it, and it wasn't covered, and it was a lot of things. So actually getting in the study
Yep.
helped me overcome a lot of those barriers and get what I needed at that time.
Yep. Which, if I could say, pinpoint off that last point as well, is just especially research participation with Whitman. You can get connected to so many other resources just by participating in a research study with Whitman-Walker. So you
So it's
don't
so funny how that you are
we,
absolutely right, because this
we
is
have a
exactly how I ended up here.
exactly
So I
job
actually
opportunities.
started.
We have that exactly. So and I think that's what my work is supposed to do. It's supposed to make research participation an actual community experience, which means connecting you with more than just resources, but people,
Yeah.
relationships, that kind of stuff should be a part of how we build it. Really.
Yeah, no, that you're exactly right. Like I literally my engagement with Whitman-Walker actually started through that study. I met a ton of amazing people and just stayed connected. And ended up now I'm here doing work with
Right.
Whitman-Walker, and never even thought that I would, work in community health, but it just kind of happened.
Right.
Yeah, it was great. All right. So, we talked about our contributions to Whitman-Walker
Right.
and both of our contributions to the CAB. But if folks are interested in, being a part of the CAB or even being involved at Whitman-Walker, do you have any advice, any resources?
For sure. And I don't know if you can pin multiple comments, but I really want to drop my email address because if folks are interested in actually participating in research studies, we're doing several right now. So we are still taking people in our cab, but even in other things that we're doing, like we compensate for most of the research participation that we do. And there's just a lot of different ways that you can help. You don't have to take a drug and make sure that it works well. You can also offer your thoughts and perspectives, and that's still part of the research process. So if folks are interested in, just getting involved with everything we've been talking about, then they should email me directly, to be honest, and I can connect them with different opportunities we have going on. And I can kind of gauge like, oh, if you're not interested in maybe, participating in a drug therapy, but you would love to talk through some things, well, there's space for that as well. So should I just type in the
Yeah,
comments?
go for it. Type it into the comments. And we're getting some, additional comments from our No Filter DC folks about how to access PrEP. So yeah, go for it. Add it in the comments. Thanks. All
Yeah.
right. So I have a very good question. Because I think this question is extremely important. One, because the focus right now is on COVID-19
Right.
and the election. So make sure you go out and vote.
Right.
So it's like, these are like everybody's priorities right now, right? Like COVID-19, how we should handle it, and then voting and how
Right.
we should do that. And so there are still priorities we should not forget about. And
Of
so
course.
when I think about a priority, it's always HIV prevention, right?
Right.
But like, what does HIV prevention look like for you, at least, during the COVID-19 pandemic?
Yeah, for sure. Definitely. I don't want us to like sort of lose sight of the multiple things that have always been important, have always been serious, have always been life threatening, inside of this. And when I think of how, or what it looks like during these times, I think it's important to acknowledge that the people who have been vulnerable to HIV or are still so. And I think especially if you think about how like when you talk about voting and COVID-19, those are things that affect everyone across the country, right? And across the whole world. And so I think that in people's minds it's like, well, this is an everybody problem. But if folks were never included in the everybody before this pandemic went on, they don't all of a sudden feel motivated to participate in public health benefits or to go out
Yeah.
and, you know what I'm saying? If you were a felon
Yeah.
before the pandemic, before Trump became elected, you still can't vote. If you were in a lifestyle where you were putting yourself at risk for whatever reasons to be exposed to HIV, that hasn't changed because of there's a pandemic going on. So it's really important that we don't act like it has. You know what I'm saying?
Yeah.
But I do think,
Yeah.
hopefully, since people are home, we can have conversations like this one and actually be honest about what is going on and actually understand it.
Yeah. So like, no, that's a good question. And this is a topic that ain't on our script.
Yeah.
But I'm curious, do you think there are going to be studies that come after this pandemic? Like, was the impact of sexual habits of people during the pandemic? What was those type of, I just know from my own personal behaviors that, it changed during the pandemic. And I'm so curious about like what community health looks like going forward, even after the pandemic. Are we going to like necessarily change, our practices and the way we engage people?
Right.
Or do we need to advise people differently? Have you like thought
Mm.
about that or heard anything, or are you seeing any like trends that are coming up?
Yeah, so there's research studies going on right now that are looking at what are the behavioral patterns of folks in our community to sort of understand how HIV is spread the way that it is. And I think it's a little late for those to be happening, right? I think the initial response was such like drug therapy and antiretrovirals, but I think we actually need to understand what are the risk factors and where they're happening at. So I'm glad that people are having that conversation just to try to get understanding on sort of like the social side of it. How are we moving? How are the apps influencing the way we have sex and the way we just get together and things like that? So I'm kind of forgetting your question as I'm talking.
No, I was just, but no, you're on target. I was just wondering what type of trends have you noticed in like a community engagement, from a community engagement perspective on like sexual behaviors or even research and the impacts COVID-19 have had on those type of things. Yeah.
For sure, yeah, and I think just basing it off of my actual community I'm a part of, some folks have moved different, some folks have not when it comes to hooking up off the apps and things like that. So, uh, yeah, I think that it gave everyone an opportunity to look at their own patterns of behavior, what motivates you to do certain things, when do you make time to do certain things, when you have more free time, less free time, just how do you move, how do you come together, who do you have sex with, how, when, and where, and why, basically we all have more time to ask ourselves these questions. So I think that just more research on sort of the behavioral health side of it still needs to be done, like just more understanding the situations that we put ourselves in and that we are placed in. So,
Okay, so kind of related. My next question is kind of related to that, but a little bit on a tangent. So, based off of that, have you seen priorities change as a community, as a medical community? If not, like, should they be changing?
right. Yeah, like you said, as far as the medical community's priorities, everything is COVID related, and for good reason, of course. I think that Whitman, I mean, we're having this conversation, right? So I think that Whitman is trying to be accountable to not let our community needs fall by the wayside because there is a global need going on. But at the same time, I think that I think that other folks are sort of getting lost a little bit. And I think that, sorry, again, I'm forgetting my thought. I think something that's interesting, and I don't know if this is really directly related, but when you think of pre-existing conditions and how like folks who, like especially communities with a lot of pre-existing conditions have been affected by COVID-19, I'm hoping that as far as priorities going forward, that maybe we actually address those priorities. Maybe inner cities shouldn't have such high rates of hypertension, diabetes, and all these other comorbidities that are making something like COVID-19 such a problem where Black folks in the inner cities are dying. Maybe, you know what I'm saying? So I'm hoping that the priorities actually sort of have like a rebirth effect where we can like retroactively address the things that were already issues. You know what I'm saying?
I know exactly what you're saying. And so it's also, so here's the thing. People of color tend to, well, not tend to, they are always all more impacted by whether it's a pandemic,
Right.
or they are always impacted the most, right? Just
Right.
because resources are typically limited on that end of the spectrum, right? And so
Right.
I do hope that this pandemic, so being an engineer, I'm all big about data and understanding how that, and so I think this has given us more data points to provide an argument on why it's important for Black and brown communities to have the resources to fight hypertension or diabetes or all the things that you mentioned, or just freaking systemic issues that limit people from having the medical resources they need.
Right.
And so like this is really putting a spotlight on a lot of that,
Right.
because it's not just a conversation within the US, it's a conversation globally about how this pandemic is impacting certain communities, whether it be whether that conversation is about the financial aspect or just the health aspect of it. It is definitely impacting Black, brown, other people of color more. And so I do think this will be a great data point to be able to have these type of conversations going forward. And
Absolutely.
hopefully we'll see more funding, more things like that from the
Exactly.
government to help fix this shit. I mean,
Exactly.
excuse my language. That language is
Exactly.
my language and not Whitman-Walker.
It's true though. It's true though. So I feel like again, I think if I could say what I said, but more neatly, I'm hoping that it does change our priorities after it's addressed to actually fix all of the underlying issues. Finally, yeah.
Exactly. All right, so we talked a little bit about, what the cab is here for. Obviously, there's no cab without people on the board.
Right.
And so, how do you think we can motivate people to continue to be a part of, the community advisory board, but also participate in research, where the results may not directly benefit them, but may benefit the community in a whole.
Right. And I think that's just a conversation that we have to have. I feel like working in healthcare, we use the word community a lot. We throw it around so often. But I think that I need to be having conversations with people who Whitman-Walker considers a community. Do you feel like a community? Who is your community? How do you understand yourself in relationship to other people who have the same identities as you? I don't want to take it for granted that just because someone is black or just because someone is gay or any other mixed identities that they necessarily feel like, oh, I'm in a community. But I think that through conversations and actually building a sense of community, then we can understand, or actually maybe I want to benefit the people who I am connected. But I think that we cannot take that relationship for granted, if that makes sense. So I think that we have to build relationships first. I need you to be well for me to be well. I need my neighbor to be well for me to be well. I need my children, my grandchildren, whether it's your gay daughters and not, you know what I'm saying? We need
Yeah.
all of us to be well and do well. And so I think it just first we have to establish that and get us all on the same page. And I think that that should be motivating us to, because at the end of the day, it's about care. So,
Mm-hmm. No, you bring up a good point. I think the reason I participate in, I mean, all this stuff, like doing this, being a part of the community advisory board is that I care about my community. And there are, unfortunately, a lot of people in my community that are impacted by HIV. There are a lot of people in my community that lack resources to even like deal with the health issues that they may be particularly faced with. And so like I do think it's our duty as
yeah,
people, as part of the community, to be a catalyst and such, to be
right.
able to connect people, to be able to provide those resources to those who may not be positioned or have those things available like we do, right?
Yeah.
And
And push it
so,
forward and push it forward. Like we should not resign to anything being in the current state that they are. Things can always be better. And so I have a very future oriented mindset. And I think research is the
yeah,
oriented thing. You know what I'm
it
saying?
is.
Benefit now to benefit people. I'm sorry, participate now to benefit people forever. I'm gonna have to write that down as a tagline.
You like that one.
I like that one.
I do want to remind everybody, if they are interested in participating in any of the studies or anything that we talked about, you can also contact Christian. His email is listed again. It's cmorris@whitmanwalker.org. If you're interested in getting involved, please reach out to him. So my last question for you tonight is, people are skeptics or have skepticism about vaccine, especially with the conversation about the COVID vaccine and how quickly we're saying we're going to get one of those out.
Right.
And so like I have my thoughts on vaccine skepticism, but I'm curious of like what are your thoughts
Mm.
on that?
Yeah, I mean, I think you're right on the nose. It's about how fast it's happening. It makes people hesitant. Being in the healthcare side, if I could say anything to people, they're doing the same number of tests and trials as they do with any other drug that's ever been on the market. They're just doing them at the same time. So they're not cutting corners, period. You know what I'm saying? So I think that people don't know how clinical trials work often. So it's like, oh, they're moving fast. Oh, hell no. You know what I'm saying? When actually
Yeah.
they're doing it the same way they do any other medicine that we've ever taken. They're just doing it. They're doing all of the phases at the same time.
Hmm.
I think that that's again like that's just an education piece that's very helpful. There's so much miseducation going on around vaccines and the virus as a whole. So yeah,
Yeah, so I actually want to add to that because I was actually in a briefing that we had for
Hmm.
the community advisory board, and I learned a lot about the
Yeah.
process of trying to get these vaccines to people. And
Right.
so I think there's a positive thing that's probably going to come from this, and we talked a little bit about this. I think as the government, as researchers, as clinicians, and people, just all the people that are involved in making this happen, we've noticed that there is a way to shorten the time span that it takes to get vaccines that we need to the market. And so I think COVID is giving that push, to kind of, for us to look at it from a different lens, maybe do things in tandem that we probably could have always, did in tandem. And so what I hope to see come from this is that instead of it taking 3 years, 6 years, 8 years to get a vaccine, for sometimes diseases and things that are actually killing people, that we had from this come up with a shorter process of making that happen. I think we have the ability. Our technologies is growing completely, and I know that just from a government perspective, I help the government be more technologically advanced, and I do know that that is happening. So I think COVID will help speed up that process. At least that's what I hope for.
I hope so as well.
Yeah.
Yeah.
So I don't see any questions per se in the comments. But anything else that you want to leave the people with?
Uh, consider how your life could benefit when you consider yourself part of a community. Actually, really think about what it means to be a member of a community, and consider what you have to gain from thinking of yourself that way and looking at life that way.
Absolutely.
You know what I'm saying? So thank you.
Yeah. No, thank you for being here. I do want to remind everybody about how important social distancing is. Obviously, is it a way to reduce? It is a way to reduce COVID-19 community transmission. So, if you're not aware of what social distancing means, that means that you need to increase your physical space between people to avoid spreading the illness. And so that involves staying at least 6 feet away from the other person when that is possible. Continue to wear your mask in public. Avoid large crowds. That includes some of these rallies that we have going on. And encourage, work from home if you can. Like, if you can work from home, do that. Also, the holidays are coming up, and I know everybody wants to spend time with their family and their friends. And I know this is going to be probably one of the most challenging times as a community that we've had to deal with that, right? If you can, try to stay in contact with those family members via FaceTime instead of in person. I know that's going to be extremely challenging, but again, you got to think about your community, the impacts that your decisions could have on the community. And so even if you don't think you're going to be at risk, social distancing still helps prevent transmission of COVID-19 to people who may be at higher risk. That could be your older aunts, that could be your grandmothers, that could be your parents, depending on how old they are. So just keep that in mind. Also, people may not have symptoms for 2 to 14 days after exposure. So also keep that in mind when you're engaging with people. Continue to wear your mask. Try to social distance as much as possible. Also, if you need any, resources or advice, you can visit whitmanwalker.org/distancing care. And we have support on navigating navigating social distancing. And yeah, we're here for you. So despite these stressful times, a reminder that we are still here for you. I will be on here every Tuesday, giving you any advice that I can serve. Continue to be kind to one another, and we'll get through this together. So Christian, again, thank you. I can't wait to, get on in our next CAP meeting and see what you have for us. So welcome to Whitman-Walker.
Thank you.
Love the work that you're doing, and I can't wait to see what else you have for the community.
Thank you. I'll see you next time.
All right, bye.
Bye.